तो join कर लेंगे, right? So today's topic was impulse control disorder, and the reason we picked up this topic was that we were covering conduct disorders and ADHD, and during the coverage of the conduct
Yes,
disorders and
sir.
ADHD,
Yes, sir.
sorry, कुछ कह रहे हैं? Okay, sorry, I
Sir,
thought.
sorry, I can't see your screen. क्या बाकी सबको भी नजर आ रही या मेरे साथ कोई इशू है? Sorry.
मैं दोबारा चेंज करता हूँ. Can you see it now? अब नजर आ रही है?
मुझे नहीं आ रही
रिकॉर्डिंग एक दफा फिर आते हैं, असल में कोई बच्चे की आवाज आ गई थी बीच में.
अच्छा, मुझे आप लोगों को अब मेरी स्क्रीन नजर आ रही है? क्यों मानूर? कैन यू सी मी? कैन यू सी दिस स्क्रीन? इम्पल्स कंट्रोल डिसऑर्डर्स.
सर, मुझे नहीं आ रही, शायद मेरे फोन में कोई इशू हो, बाकी सबको आ रही हो. आई विल रीजॉइन. ठीक है, आप करें.
नहीं, मैं इसको एक दफा दोबारा ट्राई करता हूँ. ओके, वेट. आप देखें. क्यों मानूर? कैन यू सी मी?
आई कांट सी यू, बट कोई और बता सकता है क्या कि या शायद मेरे साथ ही कोई इशू है?
हाँ जी, आई कैन सी योर स्क्रीन.
ओके, ठीक है, मैं रीजॉइन करती हूँ सर. आप लोग बात कर रहे हैं, ठीक है.
बाकी लोगों को मेरी स्क्रीन नजर आ रही है, राइट? इम्पल्स कंट्रोल डिसऑर्डर.
हाँ जी सर.
Okay, perfect. So let's start again. So impulse control disorder, the reason why we tried to pick up this topic was that we were covering conduct disorders and also ADHD in children. So I thought that in relation to that, impulse control disorder is important as well. When we try to define impulse control disorder, it is defined as a failure to resist a temptation, urge, or impulse that may harm oneself or others. During their failure, the person feels pleasure, gratification, or a relief, but after the person may blame or oneself or feel guilty or regret. So basic definition covers the topic as I have an urge, I have just something that I should slap someone, for example, and I try to resist it, but ultimately that urge is so strong that I go and slap somebody. And at that time, after slapping the person, I feel gratified, relaxed, comfortable, and absolutely okay. Maybe after an hour or 2 hours, when people try to convince me and talk to me, or by myself when I'm thinking about it, I may feel that, oh, I have done something wrong and I should not do it. So when we say impulse control disorders, there is a sudden urge to do something. You talk about gambling, you talk about fire, you talk about hitting, injuring, or anything like that. There is a sudden urge that comes to the mind, and you try to implement that urge physically doing it. So, if you talk about OCD, obsessive compulsive disorders, this definition is very much similar to OCD. And this is one of the reasons why in DSM-5, they are probably mixed together. So the impulse control disorders are related to OCD. Another important correlation between impulse control disorder is with Parkinsonism. There are lots of papers available on the net which suggest that impulse control disorders are very much common in people who later in life develops Parkinsonism. So there is some relationship with the dopaminergic system. I will try to cover that up as well. And when you have see somebody with these kind of a disorders, which we will talk in detail in times to come, thodi der mein, then you would be able to understand that the treatment is also complicated, as it is complicated for the treatment of OCD as well. So example, there are many disorders within which impulse control disorder, which include pathological gambling, compulsive buying disorder, pyromania, kleptomania, intermittent explosive disorder, dermatillomania, and trichotillomania. Dermatillomania is picking up of the skin, ऐसे जिल्द को चुटकी की तरह नोचते हैं. It's again a common symptom. And trichotillomania, when you pull your hair और उसको आहिस्ता आहिस्ता नोचते हैं. So that is, there are two things which are commonly seen. It's a very common co-occurring disorder. So comorbidity in impulse control disorder is high. Some other disorders co-occur with ICD, impulse control disorder, such as bipolar disorders, generalized anxiety disorders, obsessive compulsive disorders, PTSD, depression, and antisocial personality disorders. So comorbidity is high in disorders. What happens actually in impulse control disorder? So these are the 5 points that you have to remember. First, I will have a sudden urge. This will transform into state of stress or tension inside me. Then I will act on that urge. I will feel guilt and relief afterwards. So these 5 parameters, if somebody is fulfilling that, I should gamble. I should set up a fire. I should hit someone. Sudden urge, stress inside me, doing the act, feeling relieved, and then feeling guilty afterwards. It's absolutely just like OCD. Clinical features in DSM-5 criteria. DSM-5 requires 5 symptoms, must not occur with schizophrenia, mood disorders, psychotic features, other psychotic disorders. So if we diagnose somebody with schizophrenia and also they have some impulse control disorders, then we will treat schizophrenia. We won't consider impulse control disorder to be a problem. So वो hierarchy में, whenever you make a diagnosis, it is always coming from the top. So schizophrenia, mood disorders, psychotic disorders, if they are having impulse control disorders with them, then they should be treated first, not the impulse control disorders. Affective symptoms are common, limited capacity to express their either warm, tender feelings or anger towards others. Additional behavior symptoms, lack of close friends or confident relationships, and cognitive symptoms, marked insensitivity to prevailing social norms and convention. I will explain these symptoms very soon. Now, these are some of the clinical features of impulse control disorders according to ICD-10 and DSM-5. ICD-10, I will not focus much, but DSM-5, I will definitely do that. Salient features, at least 5 symptoms, so which I have mentioned to you earlier. Definition mein, there are 5 steps: urge, tension, act, relief, and guilt. And 5 symptoms should be there to diagnose it. 1, affective symptoms. 2, behavior symptoms. 3, cognitive symptoms. And what are those symptoms? Affective symptoms includes discomfort in situations in which he or she is not center of attention. Additional behavioral symptoms, excessive impressionistic style of speech, consistent use of physical appearance to draw attention to self, consideration of relationship to be more intimate than they actually are. So any of these, including some of other criteria, should be there. Aksar, when you are sitting in a clinical situation and talking to the patient, unless or until you will ask them, these symptoms are usually not expressed by the patient themselves. And in most of the situation, mostly even the relatives or the informants are not able to describe these symptoms unless or until symptoms are very problematic, like he has set up the fire to the house or set up the fire to something big. ये जो मॉब साइकोलॉजी है, इसमें जब जलसे जुलूस होते हैं और वहां पे पथराव होता है या गाड़ियों को आग लगाई जाती है या टायर जलाए जाते हैं, उसमें बहुत सारी पॉसिबिलिटीज ये होती है कि वो कंडक्ट डिसऑर्डर का था या इम्पल्स कंट्रोल डिसऑर्डर्स के पेशेंट्स भी इस किस्म की जगहों पे जाके अपने आप को ज्यादा एग्जिबिट करते हैं. जैसे मैंने यहाँ पे बताया कि देयर आर पीपल हु ट्राई टू कंट्रोल देमसेल्व्स बट physically they will dress in a way which is very much evident. So एक साहब हैं जो सूट पहनते हैं, सो आप कहेंगे जी सूट तो बहुत सारे लोग पहनते हैं, लेकिन सूट के साथ अगर वो लाल फूल अपना यहाँ पे लगाना चाहें या सूट के साथ वो हैट पहनना चाहें या सूट के साथ वो 3 पीस सूट पहने जिसमें वेस्ट कोट भी हो और कोट भी हो, जबकि मौसम ऐसा ना हो कि वो 3 पीस सूट पहना जा सके. सो इस किस्म की ड्रेसिंग या खवातीन में कुछ ऐसे भड़कीले किस्म के ड्रेसेस जो यूजुअली एक्सेप्टेबल नहीं होते और फोकस ऑफ अटेंशन बन जाते हैं पूरी महफिल में. सो इम्पल्स कंट्रोल डिसऑर्डर पीपल यूजुअली आर फोकस ऑफ अटेंशन इन पब्लिक and otherwise in other gatherings as well. So they are not manic, they are not psychotic, but if they have these symptoms, they are very much mature, well-to-do, good, respectable people, but sometimes you feel some oddity. So as a psychiatrist, we should be vigilant to see those features in our patients as well. So when a patient is sitting in front of you and you feel something noticeable about their dressing, about their expressions, about their talk, then definitely do ask these questions related to impulse control disorder. Antagonism, manipulativeness, frequent use of subterfuge to influence or control others, deceitfulness, dishonesty, fraudulence, misrepresentation of self, carelessness, lack of concern or feelings or problems of others, lack of guilt or remorse. खामखा किसी को क्रिटिसाइज कर देंगे, किसी के बारे में कमेंट पास कर देंगे, ओए बाबे, right? Yeah, something like that which is unusual, and you will immediately, people will start noticing them, why they are doing it, and there will be nothing as such apparent. So make sure that if something like this happens, keep impulse control disorders in the background as your diagnosis. Hostility, persistent or frequent angry feelings, anger or irritability in response to minor insults. किसी ने कहा जी इस कुर्सी पे ना बैठिए, आप इस तरफ आ जाएं. So you will immediately flare up and maybe get so much angry कि आप उस महफिल से ही उठ के चले जाएं. So these small things, consider impulse control disorders. And do ask your patients and the relatives about these things as well. Disinhibition, irresponsibility, failure to honor obligations, impulsivity, acting on the spur of the moment. मेरा दिल किया कि मैं जाके गाड़ी नहीं खरीद लूं और मैंने खरीद ली. So if I was able to afford it, then of course it's fine. But if I was not able to afford it and I bought something which was very expensive and out of proportion, I may have guilt later on about it. So impulse control disorders should be considered. Risk-taking behaviors. So reckless and dangerous situational things. Now, this is some of the pictorial representation of impulse control disorders, conduct disorders, and disruptive disorders. Like, ये slide इतनी clear नहीं है. Unfortunately, from the place where I picked up this slide I was not able to copy the image, so it's a little bit blurred. But you see the boy on the right bottom corner. He is having a fire stick, matchstick in his arm. So setting up of a fire. Then the other situation when people ये बच्चा जो है जिसने लैंप पकड़ा हुआ है, माँ खींच रही है, चलो मैंने नहीं जाना, चलो मैंने नहीं जाना, things like that. Then always bullying people, छोटे को देख के ऊपर काट लिया, उठा लिया, उसके ऊपर मुक्का तान लिया, टीवी तोड़ दिया, कंप्यूटर स्क्रीन को हिट कर दिया, गाड़ी बिला वजह साइड पोल पे मार दी, ठीक है, और दुकान पे गए, चॉकलेट उठा के जेब में डाल ली बिला वजह, बगैर किसी जरूरत के, और अगेन you can afford it but still you cannot control yourself. So keep considering these symptoms. These are all symptoms for impulse control disorders, and unless or until you will ask, you will miss them. It includes gambling, binge eating, shopping, hypersexuality, hypersensitivity to rewards, uncontrollable repetitive behaviors, and poor quality of life. So even now, when we talk about internet, watching movies on the internet, watching pornography on the internet, repeatedly every day without missing a day, searching the sites for that kind of material, it comes in impulse control disorders as well. So this is one of the diagnostic criteria which is added in DSM-5 related to the internet usage. So keep that thing in your mind as well. So अगर कोई कंप्लेंट करे कि जी ये सारा वक्त फोन पे बैठा रहता है, फोन के अलावा इसको कुछ नहीं नजर आता, consider impulse control disorders and try to rule out the possibilities by asking these questions. And then what are the risk factors? So the risk factors could be, one, demographics. So when you make some irrational decisions, then you are prone to involve yourself in some kind of a situation where you are in trouble demographically. So आप या दुनिया से कट ऑफ हो जाते हैं, या बहुत ज्यादा आइसोलेट हो जाते हैं, या लो सोशो इकोनॉमिक बैकग्राउंड में चले जाते हैं, and things like that. Then family and genetics plays major role. They feel depressed, smoking, alcohol, early onset of personality disorders, dopaminergic medication, and DBS. Again, I will try to explain these terms very soon as well again. Risk factors for impulse control disorders. Risk factors for impulse control includes, it should start before the age of 50. So जब पुरानी तस्वीरें कोई अपनी दिखाएगा और उसमें आपको ऐसी चीजें नजर आएंगी जो थोड़ी सी अनयूजुअल हों, और फिर अभी 50 के बाद भी वो सिम्टम्स परसिस्ट कर रहे हैं, then consider impulse control disorders. Somebody is unmute, so I can mute if it's okay. Okay. Then diagnosed for more than 5 years. Most of these symptoms, they keep keep having them for a longer period of time, into a milder degree. Maybe they are unnoticeable. So ऐसे ही कभी कभी महीने में एक आध दफा गए और बाजार से कोई चीज उठा के घर ले आए without paying it, or sorry again. Okay, coming back. And history of depression, anxiety, bipolar disorders, substance abuse, prior gambling, behavior problems, family history of mental dyskinesia, and dopaminergic activities possible. Yeah, Benazir, can you mute them? Thank you. Okay, coming back. So, impulse control disorders, clinical symptoms, dopamine agonist use, higher levodopa equivalent daily dose, amantadine use, early Parkinsons disease, comorbid depression. Always consider impulse control disorder as part of it. Age younger, hobbies, access to gambling, internet, pornography, money, unexplained weight gain, change in the behaviors, change in the sexual routine, change in other scenarios, consider the impulse control disorders. It's almost the same as what I mentioned to you earlier. Unfortunately, it is a cyclical pattern in impulse control disorders. So These symptoms are not very consistent. They come and they go. They appear and they disappear. And that is one of the reason why they are missed as well. कोई चीज जब कंसिस्टेंटली हो रही हो ना तो वो जल्दी पिक हो जाती है, घर वाले भी पिक कर लेते हैं और फैमिली मेंबर्स या इर्द गिर्द वाले भी. लेकिन impulse control disorders, the problem is that it comes, it disappears, it remains silent for maybe months, maybe a year, and then it will happen again suddenly once, and then it disappears again. So that is another reason why they are not presented to psychiatrists. These are the 5 or 6 impulse control disorders: intermittent explosive disorder, kleptomania, pyromania, pathological gambling, trichotillomania, and lastly, not otherwise mentioned. Okay, मैं अब आपको ये slides थोड़ी सी दिखाना चाहूँगा. Can you see them? Okay. Now, this is these are the slides that I presented earlier to some other group. I don't know where, but इसमें जो यही 5 disorders हैं उनको describe कर दिया. So initially I was thinking that I will just cover the impulse control disorder as a whole, but then I thought that I should add this one as well. So मानूर को अंदाजा है क्यों मैंने ये सोचा. ये फैज साहब का एक शेर है, अच्छा शेर है, बहुत दफ़ा सुना चुका हूँ, फिर एक दफ़ा सुनाता हूँ. छिनती हुई नज़रों से जज्बात की दुनियाएं, बेख्वाबियाँ अफसाने, महताब तमन्नाएं, कुछ उलझी हुई बातें, कुछ बहके हुए नगमे, कुछ अश्क जो आंखों से बेवजह छलक जाएं. The reason why I like this kind of poetry is that it is very close to psychiatry, very expressive emotionally, and lots of psychiatric disorders are covered in poetry as well. So this is the good part of it. So intermittent explosive disorders, what is it? Several discrete episodes of failure to resist aggressive impulses that result in serious assaultive acts or destruction of property. The degree of aggressiveness expressed during the episodes is grossly out of proportion to any precipitating psychosocial stressor. The aggressive episodes are not better accounted for by any other mental disorders, for example, antisocial personality, conduct, etc. This is intermittent explosive disorders. More common in men. It is relatively rare, but nowadays when you see the different movements, PDM का जलसा हो रहा है, इमरान खान का जलसा हो रहा है, so you may be able to see these kind of people having these kind of disorders quite commonly. It's a variable course, chronic and episodic, so it comes and disappears. एक जलसे में गए थे, रक्षा जला के वापस आ गए थे, हो सकता है कि 2 साल तक कुछ ना हो और उसके बाद फिर दोबारा इंसिडेंट्स हो. So just keep a check. Usual onset is in early 20s. The treatment usually includes multiple situations. We will talk about that too. Kleptomania, recurrent failure to resist impulses to steal objects that are not needed for personal use or for their monetary value. कोई भी छोटी सी चीज. बहुत साल पुरानी बात है कि क्लैप्टोमेनिया पहली दफा मीडिया में बहुत खबरों में आया. I was probably in the initial days of my psychiatry when I started practicing psychiatry, मुबशर साहब के साथ, अल्लाह जन्नत नसीब करे. तो उस वक्त एक वाकया हुआ था जब एक बहुत फेमस पॉलिटिशियन ने इंग्लैंड के एक स्टोर से, पाकिस्तानी पॉलिटिशियन ने इंग्लैंड के एक स्टोर से एक अंडरगारमेंट चुरा लिया था और वो फिर पकड़े गए और उसकी फिर फिल्में बन गई, उसके ऊपर बहुत सारा एक्सपोजर हुआ. उसके बाद से ये पता चला कि ओके, दिस इज अ काइंड ऑफ साइकियाट्रिक डिसऑर्डर. पाकिस्तान में एक्नॉलेज हुआ जनरल पब्लिक के लेवल पे. साइकियाट्री में तो ऑब्वियसली पहले था, लेकिन उस इंसिडेंट का एक फायदा ये हुआ कि साइकियाट्रिस्ट की वैल्यू और सिग्निफिकेंस बढ़ गई. लोगों से पूछा गया साइकियाट्रिस्ट से कि जी ये क्या होता है, ये उन्होंने ऐसा क्यों किया, उन्होंने ऐसी चीज क्यों चोरी की. So which was a good thing. So I believe awareness create हो गई. So increasing sense of tension immediately before committing the theft. दिल कर रहा है उठा लूं बस, और कोई देखे भी ना और पता भी ना चले और उठा लूं. और फिर अगेन वही क्राइटेरिया, pleasure, gratification, relief at the time of committing the theft and then steal. So related to stealing, the 5 things that I have mentioned to you earlier, all 5 of them present. It is more common in females, the kleptomania. Prevalence occurs than 5% of identified shoplifters in general population. But unfortunately, prevalence in general population is unknown. Course is again sporadic. दुकान पे गए, कोई एक आधी चीज चुराई, फिर 6 महीने के लिए सुकून रहा, 6 महीने बाद फिर गए और एक पाव पिस्ते का लिफाफा उठा के ले आए. ऑल्दो अगेन अफोर्ड कर सकते थे, पे कर सकते थे, जरूरत भी नहीं थी, लेकिन फिर भी ये कर दिया. सो दैट इज इंपॉर्टेंट. एंड अगेन, as I mentioned to you, because it is so sporadic that usually not diagnosed, but it is not such that it's not seen in general public. You'll be able to see it if you will be able to understand what I'm talking about. Usually associated with bulimia, mood disorders, substance abuse, and personality disorders. They say that parenting and childhood experiences are contributing factors. How? Maybe I'll be able to cover that as well. Pyromania, deliberate and purposeful fire setting on more than one occasion. This is very, again, interesting as well, because if I have an urge to lit up a fire, to make sure that it is acceptable, what I'll do is that I will go outside, कोयले लूंगा, अंगीठी में डालूंगा और आग लगाऊंगा और फिर फ्लेम्स को उठता हुआ देखूंगा. So it is acceptable for people around me to see me setting up a fire outside. It could be pyromania. If there was an urge to set up a fire and I was not able to resist the urge, I went outside, I fired it, I felt relaxed and comfortable, and then later on I felt guilty why I wasted so much time and so much money on coal and other things to set up this fire. So वो पहली वाली definition जो मैंने बताई है. So एक acceptable domain में भी रहते हुए आपको pyromania मिल सकता है. Pyromania is the term which is used in psychiatry, and forensic term for this problem is arson. Arsonism is the kind of an act in setting up a fire which fulfills this diagnostic classification. However, legally, we don't use pyromania. Legally, we use arson, arsonism or arson, right? So that is the major difference. This, unfortunately, again, is a complicated, because people who do that have a considerable planning. They have advanced preparation. As I mentioned to you, that if I have an urge to set up a fire, I will go out, make some arrangements, buy coal, put them in some place there, and then set up a fire and then enjoy it. So it could be nothing noticeable for the people around me. Reaction to fire setting is gratification, pleasure, release of tension, indifference or satisfaction, consequences of behavior, property damage, legal consequences, injury, loss of life to fire setters or others. Now, these are complications. So if I'm not very careful and I'm casual, so मैं घर में कोशिश करता हूँ माचिस की तीली जला के ऐसे फेंकने की, और ऑब्वियसली वो स्ट्रेस मेरा कम हो जाता है और मैं रिलैक्स भी होता हूँ, लेकिन वो माचिस की तीली जलती हुई अगर किसी ऐसी चीज के ऊपर गिर जाती है जहां आग लग जाती है, सो इट कुड बी लीथल एज वेल. सो इट वाज विदाउट द पर्पस ऑफ एक्चुअली डूइंग इट, बट इट कुड बी lethal. So this is unfortunately a problem. This usually occurs very commonly in childhood, but as you grow up, it never goes away. The urge is still there. So the fire setting is common in children, but it goes throughout the life unless or until it is treated. Common in males, typical course again, episodic. It's not regular. Pathological gambling. Now, I was not able to see this when I was in Pakistan, but when I came to this place, this is a common symptom, a common problem. I at least have 5 patients here who are having pathological gambling. Now, why I was not able to see in Pakistan, there could be multiple reasons for that. Again, as I mentioned to you, that if family is not in a trouble, then they won't bring those people to our notice. But I definitely know that pathological gambling is the situation when cricket is in fashion and cricket is played. People do bet. ये जो स्नूकर के क्लब्स बने हुए हैं मुख्तलिफ घरों के नुकड़ों पे, वहां पे भी there is a definite gambling situation. और कार्ड्स प्ले करते हुए पैसे लगाना ताश के ऊपर, कार्ड्स प्लेइंग पे, वो भी कॉमन है. लेकिन अगेन बिकॉज दिस इज टू अ लिमिटेड डिग्री, when it's people don't feel it to be a problem. Here, because there are officially casinos and gambling spots, so people lose all of their wealth as well in that kind of a situation, which is unfortunately noticeable. So law is involved, police is involved, and then you are broke, so you come to the attention of psychiatrists as well. But in Pakistan, somehow or the other, it's hidden, so not too much seen too much. Although I know that it's there, but I haven't seen patients coming to me for their treatment specifically of this problem. After losing money, gambling often returns another day to get even. This is unfortunately the problem. So ye criteria mein gambles as a way of escaping from problems or relieving a dysphoric mood. After losing money, gambling often returns another day to get even. Lies to the family members or the therapist or anybody who's treating them. Has committed illegal acts such as forgery, fraud, theft, embezzlement to finance gambling, and relies on others to provide money to relieve a desperate financial situation, which I believe you all know what that I'm talking about. Distortion in thinking. So there is a denial. I don't have a problem. I am okay with it. It's just that I feel like doing it, so I do it. I enjoy it. It's just a way of relieving my stress. So acknowledgement and acceptance of the problem is not there. These people are actually quite workaholics. So they are good workers. They are very promising, progressive, dynamic people. But unfortunately, they lose money in gambling time and again. And it is, again, comorbid with other disorders that I have mentioned, with other impulse control disorders as well. Trichotillomania. I saw at least 7 to 9 people in Pakistan with trichotillomania. Very good response to the treatment, very good outcome as well. So mostly seen in young girls. They come with the complaints that they have a urge to pull their hair, or sometimes sar ke upar there are patches where their hair is lost. And it's, again, as I mentioned, it's common. It's not very uncommon. An increasing sense of tension immediately before pulling out the hair. So I'm sitting and I'm just keep on doing like this. And same as with the skin as well, skin picking. So I keep sitting and pinching myself to an extent that there is a bruise, there is again some bleeding or a wound which needs to be addressed. So I have a patient here who is suffering from a syndrome. Again, as I mentioned earlier as well, that in Pakistan, we were not able to see the syndromes in psychiatry because we were not able to get them tested through the microarray for genetics. Here, the microarray for genetics is common. So if I feel that there is something wrong with the genes, I send the microarray for genetics and I get the results and report. So this lady is suffering from Prader-Willi syndrome, and part of it is trichotillomania and dermatillomania, where they pull up the skin and damage themselves. So, but in Pakistan, when I was treating them, unfortunately, I was not able to do that test, but of course, I was able to treat them, and the response was good, and outcome was good as well. So trichotillomania, most common site for hair pulling is the scalp, eyebrows, and eyelashes. Triggers relaxation, distraction, stressful circumstances, itch-like sensation, and being alone. So when you are sitting all by yourself and you are lost in your thoughts, you are thinking something, you keep on pinching yourself till the time you injure yourself. It is unfortunately very problematic situation. This is a common thing, hair twirling. बालों को पकड़ के मोड़ते रहते हैं और ये लड़कियां खास तौर पे again they do that. But if, and again, you don't consider it to be abnormal because you are just trying to keep yourself busy with fumbling with your hair. But if this goes beyond that and you start damaging them, you try to put them in your mouth, or you eat the hairs, or you nail bite to an extent that you damage your skin and you damage the fingers, which is again commonly seen around. But nobody goes for a psychiatrist to get the treatment for it. नोच नोच के नाखून खा खा के वो अपने जख्म कर लेंगे, लेकिन वो हेल्प नहीं लेंगे, बिकॉज अगेन क्योंकि वो किसी को भी नुकसान नहीं पहुंचा रहे और उनको खुद भी कोई खास प्रॉब्लम नहीं हो रही, सारा गुजारा चल रहा है, सो दे डोंट गेट द ट्रीटमेंट. बट इट इज कॉमन. Excoriation, pulling hairs from other people or animals, or pulling fibers from the objects is common situation. It is more common in females. Usually they say the males and females are equally prevalent, but more common in females. And onset is again early adolescence. ये शेयर सुनाता हूँ, उसके बाद थोड़ा सा ट्रीटमेंट स्ट्रैटेजीज पे बात करता हूँ. बेदम हुए बीमार दवा क्यों नहीं देते? तुम अच्छे मसीहा हो, शिफा क्यों नहीं देते? मिट जाएगी मखलूक तो इंसाफ करोगे, मुनसिफ हो तो अब हशर उठा क्यों नहीं देते? So if we are really good psychiatrists, we should talk about these issues commonly so that these people, we are able to treat them properly, and it's a good prognosis, good outcome, less of the problems other than again just mentioning it कि जी नाखून खा रहे हैं, जख्म कर रहे हैं. So it can be controlled and improved. Treatment usually involves behavioral intervention, CBT. Drug treatment is tricky. Now, drug treatment is not only tricky, but it is good as well. So SSRIs are the mainstay, because SSRI, the treatments for the OCD and impulse control disorders as well. So there are lots of literature available which indicates that high dosage of the SSRI can help impulse control disorder. Similarly, clomipramine, which recently I was looking into some group chats, and it's not available in Pakistan, so people are shouting about it that this was a very good drug and unfortunately withdrawn from the market, which is creating a problem. I mentioned to you earlier about the anti-Parkinsonism. So Parkinsonism and the correlation to impulse control disorder. So sometimes amantadine and these drugs help, and as they are related to some pleasurable feelings on their own and opioids, so naltrexone helps sometimes as well. So which is a good situation. So you can see, that they can help. Now, pathogenesis. So the reward stimulus, the orbitofrontal cortex. Even in OCD, this orbitofrontal cortex is the key place where the thoughts keep on circling at one point. There are reverberatory circuits. So when you are attempting a question in the exam for impulse control disorders, pathogenesis, remember that there are reverberatory circuits in orbitofrontal cortex, जहाँ पे ये सोच फंसती है. That leads to involvement of nucleus accumbens and dopaminergic pathways, which leads to, again, hoarding, gambling, shoplifting, buying, drug addiction, and other issues. So simply, when you talk about psychopathology or pathogenesis, orbitofrontal cortex area of the brain ventral tegmental area of the brain, dopaminergic pathways, and leading to impulsive situations. Clinical characteristics of impulse control disorders. Now, epidemiology, although I mentioned it, slide figures there in the previous slides, but remember, if the epidemiology in the exam situation comes in, kleptomania presents between the ages of 16 to 20, trichotillomania 11 to 13, intermittent explosive disorders 14 to 16, pyromania 18, pathological skin picking between the 30 and 45, compulsive buying 18 to 30, and compulsive sexual behavior around 18. So if you see the age, it's usually in youngsters, right? Most of them, they are diagnosed or they present between the ages of 15 and 22. Only pathological skin picking has a late onset of 30 to 45. Rest of them, early presenters. Mostly females, 93% are females, less in males, except for pyromania, pornography and internet addiction, which is more in males than as compared to females, and intermittent explosive disorders. Lifetime comorbidities, substance abuse disorders are common. OCD is common. Anxiety disorders are common, and eating disorders are common. And there is a strong family history of psychiatric morbidity in most of these patients. There is a relationship between Parkinson's disease and impulse control disorders, and it's very complex. मुझे काफी देर लगी थी इसको समझते हुए, लेकिन सिंपल वर्ड्स में बता रहा हूं कि डोपामीन having problem in ventral tegmental area leads to impulse control disorder, which is the key area related to Parkinson's disease as well. So there is a connection between the two, and if in exam situation somebody asks you, you can respond to it. Most of these disorders are difficult to treat, not because it's difficult to intervene. The only thing is that you have to make sure that your diagnosis is right. If your diagnosis is right, then SSRIs, Parkinson's drugs, naltrexone can be tried. No antipsychotic. Antipsychotics never help. And then CBT and behavior therapies are basically the mainstay of the treatment. Right? Thank you very much for bearing this with me to listen to this thing. Okay. Do you have any question? क्यों महविश समझ आ गई कि नहीं आई?
अच्छा, इंटरेस्टिंग टॉपिक है, और ये इतना, क्योंकि हमने इतना पढ़ा नहीं है एमएम के लिए भी, तो अभी यही इन्फॉर्मेशन फिलहाल मेरे लिए बेसिक इन्फॉर्मेशन है, तो आई कांट थिंक